As a cardiothoracic surgeon, I routinely manage patients with heart valve diseases, which affects the normal flow of blood in the heart. These valves acts as one-way gate which allows efficient circulation. When these valves become narrowed, called as stenosis, or leaky, called as regurgitation, the heart is forced to work much more harder, which leads to symptoms and eventually heart failure if untreated. The common causes of these heart valve diseases are degenerative and age-related calcifications, rheumatic heart disease, which are still very common in our country, congenital heart disease, which are since birth, and lastly, infections such as infective endocarditis. The most common way of diagnosing these heart valve disease is a 2D echocardiography, which tells about the morphology and function of the heart valve. What are the surgical options for the heart valve disease? First is valve repair, which is my preferred approach, especially in mitral and tricuspid valve disease. The advantage of valve repair is that it preserves the native valve of the patient. Second, it leads to a better heart function. And thirdly, it prevents the long-term side effects that a prosthetic heart valve can have. The second option is the valve replacement. In valve replacement, we remove the native valve of the patient and put a new prosthetic heart valve. There are two options for that. One is mechanical valve and second is bioprosthetic valve. The mechanical valve has a longer durability but requires lifelong anticoagulation. In bioprosthetic valve, lifelong anticoagulation is not required, but the lifespan is much lesser. The option for choosing both of these valves are determined by multiple factors such as age, lifestyle, occupation, medical condition, and lastly, personal preferences. As a cardiothoracic surgeon, my focus is on delivering precise, evidence-based, and compassionate care. Every patient receives an individualized treatment plan, clear counseling, and continuous support through the surgical journey. So if you or a family member has been diagnosed with a heart valve disorder, kindly consult a cardiac specialist as soon as possible so that the outcomes can be better.